This is a podcast of the Nuffield Department of Medicine. Today we speak with Dr. Jacob McKnight about neonatal nursing in Kenya. Morning, Jacob.
Morning.
Can you tell us about nursing care for sick babies in Kenya?
Yes. The first thing to mention before I really begin is that I'm a small part of a big team in Nairobi, and while I'm helping organise, the people doing the hard work are out there, probably doing night shifts last night, in fact. What I can tell you about neonatal nursing in Nairobi is that these nurses are extremely busy. They have very busy working lives, but also personal lives. So in the hospital, we see very big ratios of nurse to patients, something like one nurse to perhaps 45 sick babies on the worst shifts, and then again some lack of resources, some kind of lack of appreciation as well. And then, of course, these nurses have their own personal lives. They have families, and sometimes they need other jobs to pay the rent. So they're very busy and very stressed as a result of this particular situation. So they're the most immediate things. But then there are other things as well about management styles and about the way that the wards themselves are run. And then some more cultural issues as well about how these tiny, very sick children are seen.
What are the ethnographic challenges?
The ethnographic challenges are quite significant. The first of them is that there's a period of scandal in nursing in Nairobi in particular. At the moment, the national press have covered some significant scandals in some of the hospitals we're working in. In addition, there are strikes and legal cases and all these kinds of things. So nurses are very reticent to talk. And then in addition, we are in these extremely busy wards, and we're studying why these nurses are so busy. We don't want to take them out and take their time. So just getting the work done can be quite difficult. Can
you tell us a bit more about your team's research?
Sure. Yeah, we are finding, as I said, some very interesting stuff around the immense pressure that these nurses are under. But within that, they still turn up for work. So what do they do on the shift? How do they get through it? They put in significant effort to cope with these extremely stressful environments and this very emotional job. And that's something that we see anchoring the shift in at both ends, and some certain tasks that they elevate within their job to give them some kind of a reprieve. But this is all it's ongoing research, and so these are all very early findings. But yeah, it's a very peculiar and interesting field because of the stress that's on these nurses.
Which are the most important lines of research that have developed in the last 5 to 10 years?
Well, I think what I'm most proud of with this project, and the reason I'm involved really, is that we've given ourselves a chance to learn about an environment before we jump in with any particular intervention. Here, this is a very particular situation, and as I've mentioned, the nurse is very stressed. There's lots of political context, economic context to their working lives, and by conducting ethnography, we have a chance to learn about all of that before we devise a strategy to go in and help. So I'm part of a larger team which will draw together various strands of evidence to try and design something that fits based on the best evidence, rather than just something that we thought of or something that we took from the international literature and just dropped into a new context.
Why is this research so important, and why should it be funded?
For that last reason in particular, it's quite novel in the field, and I think the larger field of public health could do with a bit more of that. But in particular with newborns, we've missed in sub-Saharan Africa quite a few of the Millennium Development Goals and some of the other targets that have been set. And it's been identified that the first 2 days of a child's life they're particularly vulnerable. And for children that are born in hospitals, the survival rates in these hospitals can be quite poor. So this is an area that, if we get it right, we could have a really large effect, which is what we're aiming for.
Finally, how does this research fit within translational medicine in the department?
Within translational medicine, well, yeah, some of the things that I mentioned about how this project is different are also part of the kind of larger trend of translational medicine. I understand that term in meaning that you need to be more careful about how you bring new ideas, new treatments, et cetera, to the field. And here, obviously, we're spending a lot of time in the field before bringing through an intervention. So I think this is very much an example of that, albeit in health system strengthening rather than in drug development as such, which is where I think that phrase is often used.
Thanks very much, Jacob.
Thank you.